A 70-year-old patient with a past medical history of high cholesterol came into the IM office complaining of right shoulder pain for the past 5 days. This happened after she fell on an outstretched arm playing with her grandchild. The pain has progressively gotten worse over the past 5 days. She's tried ice as well as Tylenol and heat, all of which haven't been working. Her pain has been consistently a 5 out of 10, but when she raises her hand over her head, it's about an 8 out of 10. She describes it as achy and tight, and she notices it a lot at night and is keeping her up. She has associated weakness and tenderness in that arm, and that occurred after the fall. She also denies any fever, any shortness of breath, sweating. She does have that history of high cholesterol for the past 20 years, but denies any history of rheumatoid arthritis, osteoarthritis, osteoporosis. She does have a family history of osteoporosis, but no family history of rheumatoid arthritis or osteoarthritis. She has a 20-year PAC history, no recent travel, but is a very, very active patient with a healthy diet. She has seasonal allergies as well as a penicillin allergy that causes a rash. Her medications include atorvastatin 20 milligrams by mouth. That is to manage her high cholesterol, and that's every day. She takes loratadine 10 milligrams as needed by mouth for her seasonal allergies and is on Tylenol extra strength every 6 hours for her shoulder pain. On physical exam, she generally looks well nourished. Her vitals were that she was 5'7", 144 pounds. Her heart rate was 88, respirations were 15. O2 was 100% on room air. Her blood pressure was slightly elevated at 142/92, and her temperature was 98.7. Her skin was unremarkable other than that tenderness. She had full passive range of motion, which was denoted by her negative NIRS test. She also had a negative SPEEDS as well as Hawkins test. She was unable to complete her ARC test due to pain. She did have a positive drop arm lift off and empty can test. I ordered an x-ray and an MRI. The MRI is pending, but the x-ray showed a high riding humeral head. My assessment is that the patient has a rotator cuff tear. I'm going to treat this outpatient. I'm waiting for the MRI to come back, but further evaluation really isn't necessary at this time. I'm going to refer them to physical therapy. I want them in there for about 2 to 3 weeks. To get them in there, I'm also going to give them a steroid shot just so that they feel a little bit better and maybe get some sleep. With this, I'm going to educate the patient not to be taking any ibuprofen because it can increase the risk of GI bleed. I also want to let the patient know that the physical therapy isn't going to repair the tear, but build up the muscle around the shoulder. I also want to let them know if they're having any severe changes, skin changes, fever, anything like that, they should come back to the office to go to the ER.